This is Eye on New York for Sunday, October 11th, 2009. Now, from the CBS Broadcast Center in New York City, here is Dana Tyler.
Good morning. Welcome to Eye on New York. Today we begin with an eye on our children's health. A new government survey suggests the number of children diagnosed with autism might be much higher than first thought. The American Academy of Pediatrics asked thousands of parents whether their children had ever been diagnosed with autism, and the number who answered yes surprised even the experts. 1 in every 100 children may have it, but some are questioning the findings. CBS 2's Dr. Holly Phillips reports.
Sure, and what's your boo-boo called?
Franklin Becker's son Sean was diagnosed with autism at 23 months. As an autism activist, he wasn't shocked by the numbers.
I think it's horrifying. I think it's crazy, and we need to do something more as a society to, to stop this. We need to find, the reasons why.
From an early age, Allison and Michael Walmark knew their son was different. By age 2, therapists suggested he might have ASD, autism spectrum disorder.
When it sort of came around 12 months and he wasn't pointing and he wasn't clapping and he wasn't saying mama or dada, I saw that my friends' children were doing that and he wasn't.
The latest government study estimates that 673,000 children in the U.S. have autism. That's 113,000 more than previously thought. In fact, parents reported about 1 in 91 children had autism, including mild forms, such as Asperger's. But experts say the term autism may be overused.
The application of this is limited. I think that since it's based on parent reporting of diagnoses, it has all the inherent limitations of that issue, which includes you don't know who made the diagnosis and whether those individuals are accurate. Maybe the label autistic spectrum disorder is correct, maybe it's not. However, if we identify that there's a need, that means that we're going to do intervention.
The Walmark family jumped into action early, and Ethan, who's now 4, is making progress. And Becker believes that's what's most important for his son.
We're actively trying every day new methods that will hopefully one day make a difference in his life.
Dr. Holly Phillips, CBS 2 News.
The Centers for Disease Control will release a study in the next few months with more rigorous reporting standards, but that study is also expected to show similar numbers. For more insight, Dr. Charles Cartwright, the director of the YAI Autism Center, joins us now to discuss the alarming statistics. Dr. Cartwright, thank you so much for being here.
Thank you for having me.
What do you read of this? How do you take this all in, and how concerned are you with this increase in the number of cases?
The YAI Network, we're very concerned. It's a public health crisis. We need to be providing services to these individuals who are being identified as having autism spectrum disorders. Now, the important issue is the distinction between making the diagnosis and the actual case. And I think the point about making a diagnosis is there's tremendous awareness now on autism and the signs of autism. And we are making the diagnosis because there isn't the stigma attached to making the diagnosis of autism as there was in the past. And we know that early intervention is key to long-term outcome. In terms of it being a real actual increase, that's the critical question, because what biological factors are playing a role? Genetics is a very important part of the understanding of what causes autism, but environment plays a role as well.
I was shocked here in reading some of the information provided here. In New York City, the number of children with autism has increased by more than 70% since 2001.
It's astounding.
It really is.
It's astounding. And we cannot explain that just simply by an increase in diagnosis made. In a study that was published in January in the Journal of Epidemiology, what they found was that, yes, there's increased diagnosis, but there's an unexplained factor, which is what environmental factors, what genetic factors are playing a role that might be underlying this increase in rate.
When you speak environmentally, what specifically do you mean?
I think we all are aware of the tremendous focus on vaccinations. And there are a number of studies that really have pointed away from supporting the vaccinations and mercury from playing a role in the incidence and prevalence of autism. So what other factors could there be? Environmental toxins, that's certainly an area that we need to look at. And so I think the shift at the National Institute of Health and the CDC is toward really looking at the role of environment in its causation of autism.
As we saw in Dr. Phillips' this piece, every parent of a newborn is watching for all these milestone signs.
Right.
To make sure his or her, the baby, is doing what
Absolutely.
they should do. And autism, the spectrum, is just that, a spectrum. It's just not one set of standards, set of symptoms. So what should parents be looking for?
There are three areas: social, communication, and interests and behaviors. Social is the infant and toddler showing interest, looking at making eye contact, babbling, imitating. Is the infant and toddler beginning to use single words, responding to name? What about repetitive behaviors? Does the infant show patterns of repetitive behaviors in the first year of life, second year of life? These are signs that we need to be, parents are aware of, need to be aware of in order to pick it up early, present it to pediatricians and clinicians, be able to even get to the point of a diagnosis and then start intervention.
What type of work do you do at the YAI Center? It's on 34th Street here in Midtown. What goes on there, and what ages do you help?
The YAI Network is a wonderful organization. It's been around for the last over 50 years. And we provide services for the lifespan of an individual and family who are affected by autism, from early diagnosis, early intervention, preschool programs, and then day programs for adults, residential programs, really wonderful group homes in the community, integrated into community. We believe in really promoting health, well-being, independence of individuals who have autism and their families. Helping families. Families are so affected by having a child, adult who has autism, and we need to provide support for these families, and that's what we do.
You're also, I must think, have your eye on just the controversial side, and there's more than one, but just government help. And then at what stage does that come? Is it at the wrong time? Are people missing out? Are they getting too much?
It's, you know, I think, as I mentioned earlier, about picking up signs and doctors making the diagnosis, starting intervention. The shift in, you know, previously people with intellectual disability were not receiving the diagnosis of autism. Now they are. There's tremendous an amount of services available to individuals with autism that are not available to individuals who have intellectual disability and other developmental disorders. So yes, there is a concern about too much being focused on autism, but I think there's never enough, because there's such a need for individuals with developmental disabilities, with or without autism, to receive services.
Thank you, Dr. Charles Cartwright. Thank you so much for your insight this morning. We appreciate it.
It's a pleasure. Thank you for having me.
And letting us know about the YAI Network.
Yes.